Hi, I'm Dr. Christina Wu. I'm a GI medical oncologist. I'm also an associate professor in hematology and medical oncology at Emory University Winship Cancer Institute. So the question is about how we are seeing a younger population of patients being diagnosed with colorectal cancer. What are unique to their care, and what should they be asking their doctors about? So it is true, we are seeing younger and younger patients being diagnosed with colorectal cancer. We still don't quite understand why that is. And so first off, I would ask that anybody who's experiencing any unintentional weight loss, change in bowel movements, rectal bleeding, that they can talk to their primary care physician to talk about working that up, because we do not want to disregard any of those symptoms. Let's talk about patients who have been diagnosed with colorectal cancer. I think with a young age, there are definitely a different focus and set of things that we should be thinking about compared to our patients who are diagnosed with colorectal cancer in an older age, for example, in age 70 and above. I think the first thing to think about that often comes up is fertility issues. So before we start surgery, or talking about chemoradiation and chemotherapy, we should talk about fertility and whether they want to do sperm banking or save their eggs. This should come up in conversation. Sometimes you're not well enough for that to happen, and that's okay, but it should be discussed. The second thing is a lot of our younger patients may be students and maybe just joined the workforce or don't have good enough insurance coverage. So I think it's important for a social worker, financial navigator to help you navigate through all that, because you may not have needed much in the way of healthcare until this cancer diagnosis. And thirdly, thirdly, we should also talk about a referral to genetics or having some sort of workup with regards to any hereditary predisposition for you to develop cancer at such an early age. In colorectal cancer, we generally think about Lynch syndrome or something called familial adenomatosis polyposis, and that's where people have a lot of polyps. And I think a genetic consult is probably worth doing to see if any of your family members have had a history of cancer and whether any of your other first-degree relatives are at risk of cancer as well. And sometimes knowing the cause can help change how we want to offer a surgery and how do we want to offer chemotherapy, and even the way we're going to do surveillance. And finally, I think that our younger patients don't have many peers to talk to because they are not in an age group where a lot of people are developing cancers. And so I think it's important for support groups to be made available for our social worker to reach out to you, and whether it be with our spiritual health or social workers or therapists that we can connect you with. I think that's very important because you may not have an outlet that other older patients may have already known about or heard about from their friends and family. So on the whole, I do think that there are unique challenges for our patients, for our younger patients, and these should all be considered.